Okay, so you've given us some really interesting sources today. They detail this huge announcement from late 2025, a really significant voluntary agreement between the Trump administration and Pfizer. And it looks like it goes way beyond just drug pricing. It seems to try and, well, reshape the whole interaction between big pharma, the government, and even global trade. So we're not just going to skim the headlines here. We want to dig into the fine print, right? Our goal is to really unpack the core trade-offs in this deal. What exactly did Pfizer give up on pricing for patients? And crucially, what did they get in return? Because it sounds like there were some pretty big commitments financially and maybe regulatory-wise, too.
Absolutely. And what strikes me is just how politically intricate this whole thing is. It's not a simple swap. The sources really showed this agreement pulling together three major policy areas that, well, often operate separately. You've got drug pricing for consumers, then this massive push for U.S. manufacturing investment, and finally, the use of international trade tariffs. So synthesizing those specifics, that's really the key to getting what this deal is truly about.
Okay, let's try and unravel that synergy then. It sounds complex. Where should we start? Maybe with the piece the public sees first, the pricing. This agreement, announced late September 25,
Right.
it made Pfizer change how they price some drugs. What was the core promise on cost?
Right. The immediate hook, the main benefit highlighted, focuses very specifically on Medicaid patients. Pfizer committed, basically, is promised to give Medicaid access to their drugs at what the document call most favored nation pricing. And that term itself, MFN pricing, that's a big deal. It immediately links U.S. domestic pricing to what happens internationally.
Okay, MFN, most favored nation. Sounds powerful, but it also sounds like, heavy trade jargon. For listeners maybe not steeped in policy speak, how should we understand what that benchmark really means? Like, what's the practical effect?
Yeah, it's usually a trade term, but here it essentially means Pfizer can't charge Medicaid more than its lowest price offered elsewhere, specifically internationally. It stocks a U.S. public program paying more than, say, a foreign government. And the sources are very specific here. They name the benchmarks, Canada and Germany.
Canada and Germany. Okay.
Exactly. The idea is if those countries negotiate a lower price because, well, they have strong national health systems that negotiate hard,
Huh?
then that lower price has to be offered to the U.S. Medicaid system, too. It's kind of an unprecedented move trying to directly import those foreign price controls into a big U.S. program like Medicaid.
That does feel like a major shift. Now, okay, politically significant, yes. But what about the dollars and cents? Do the sources give us a sense of the financial impact? Like, what are the projected savings from this MFN pricing for Medicaid?
They do mention figures. The stated outcome, the savings projection, is in the hundreds of millions annually.
Hundreds of millions.
Annually, yes. So it's presented as an immediate, measurable saving for the Medicaid program and, by extension, for taxpayers.
Okay, hundreds of millions isn't nothing. It's definitely a win on the patient side of the ledger. But let's put that in context for a second. Pfizer is massive, right? A
Yeah.
global giant. Is saving hundreds of millions a year a huge hit for them? Or is it maybe more like a calculated cost, something they agreed to in order to maybe get something much bigger on the other side of the deal?
That's precisely the critical lens we need here. You're right. For a company with revenues in the tens of billions quarterly,
Huh?
hundreds of millions annually, while definitely important for Medicaid's budget, it's, let's say, a manageable concession. It probably buys them significant goodwill. And more importantly, it seems to have secured them some major long-term advantages. Which brings us to the quid pro quo.
Exactly.
Yeah.
The other side of the coin. So Pfizer agrees to MFN for Medicaid. What did they commit to in return? You mentioned advantages. Was there a big financial pledge?
Oh, absolutely. This is where the scale just explodes. In return for those pricing changes, Pfizer pledged an investment, a massive one, $70 billion over several years.
$70 billion with a B.
$70 billion, yes.
Okay, just so you, the listener, can grasp that, $70 billion. That's bigger than the entire economy of quite a few countries.
Yeah.
How does that stack up against, say, Pfizer's usual spending in the U.S. or their normal R&D budget? Is this number unusually large?
It's definitely substantial. I mean, Pfizer always invests heavily in R&D, maybe $8–10 billion a year, sometimes more. But a single pledge of $70 billion, specifically earmarked over several years for U.S. manufacturing and research, that's different. It's a very large, very targeted commitment. It signals a serious long-term plan to build up or maybe even bring back operations stateside. It goes beyond just regular R&D bumps.
And do the sources specify what kind of manufacturing and research this huge investment is for? Is it general or targeted?
It's targeted. The commitment seems aimed at boosting domestic capabilities in really high-value areas. The sources mention cancer treatments, vaccines, and other novel therapies. So this isn't just about, building factories for simple pills. It's about advanced stuff, complex biologicals, cutting-edge R&D capacity right here in the U.S.
Okay, so we have MFN pricing for Medicaid saving hundreds of millions, exchanged for a $70 billion U.S. investment pledge from Pfizer. Now, you mentioned three levers. What was the third piece? The government side. Did they offer Pfizer some kind of regulatory break or trade deal?
Yes, and this is the really crucial link. The part that makes this more than just a health deal, it brings in trade policy directly. In exchange for the MFM pricing and the $70 billion investment pledge, Pfizer got a 3-year reprieve.
A reprieve from what?
From proposed import tariffs. Tariffs the administration had apparently been considering or developing.
Wait, hang on. Import tariffs. Like the taxes you put on goods coming into the country, usually aimed at like China or Europe. You're saying those were used as a bargaining chip in a drug pricing deal with a U.S.-based company. How does that work?
It works because big pharma, including Pfizer, relies heavily on global supply chains. It's incredibly complex. They bring in raw ingredients, chemical precursors, sometimes even finished drugs from overseas facilities. So if the administration had slapped new tariffs on those imports, Pfizer's costs could have shot up significantly. It could have really disrupted their operations.
Ah, I see. So the threat of tariffs was the leverage.
Exactly. The government seems to have used that threat, a pretty big stick, to nudge Pfizer towards two things they wanted. One, lower drug prices via MFN for Medicaid. Two, that massive $70 billion commitment to keep investment and jobs in the U.S. The 3-year tariff reprieve was the carrot, the immediate tangible reward for Pfizer playing ball on the pricing and the investment.
Okay, that really clarifies the trade-off. Pfizer avoids potentially huge tariff costs, gets some predictability, while the administration gets to announce lower drug prices for Medicaid and a massive win for Made in America. But wasn't there one more piece? Something about a new way to distribute drugs.
That's right. The deal wasn't just about pricing and investment and tariffs. It also included the announcement of a whole new federal initiative, a direct-to-consumer platform detailed in the sources. It's called Trump RX.
Trump RX. Okay, tell us about that. What's the plan? When does it launch? What's it supposed to do?
The website, Trump RX, is slated for an early 2026 launch, according to the documents. And its core function is potentially quite disruptive to the current system. It's designed to let patients buy certain medications directly from the manufacturers at a discount, bypassing a lot of the usual chain.
When you say usual chain,
Yeah.
you mean distributors, wholesalers, and I assume the pharmacy benefit managers, the PBMs.
Exactly. PBMs are the big players here. They negotiate rebates, manage formularies. They're kind of the gatekeepers between drug makers and patients or insurers.
So, setting up a federal website for direct discounted purchases. That sounds like a direct challenge to the PBM model, doesn't it?
It certainly looks like an attempt to create an alternative channel, one that potentially circumvents the PBMs for certain drugs. Theoretically, if it works, it could allow savings to flow more directly to the patient or maybe the payer instead of getting caught up in rebates.
And given this was announced with the Pfizer deal, I assume the first drugs available on Trump RX when it launches will be.
Correct. The sources state it will begin with select Pfizer medications.
Makes sense.
Yeah, Pfizer effectively becomes the pilot partner. They get to use this new government-backed channel first, maybe increase their volume while still offering those agreed discounts.
Okay, let's try and pull all these threads together for the listener. We've got this complex voluntary deal. It seems to trade Pfizer offering MFN pricing on some drugs for Medicaid in exchange for Pfizer making a huge $70 billion investment in the U.S., and the government giving Pfizer a 3-year break on potential import tariffs, plus launching this new Trump RX direct purchase website with Pfizer as the first partner. If we step back, what's the overall strategy here? What was the administration trying to achieve by tying all these different things, pricing, investment, trade, distribution together?
Well, looking at the big picture painted by the sources, it looks like a very muscular strategy, a highly leveraged approach. The administration seems to be using two powerful tools. One is the threat of trade actions, those tariffs, which hits Pfizer's global bottom line. The other is the promise of guaranteed U.S. market access through Medicaid pricing stability and this new Trump RX platform. They use those levers to push Pfizer towards specific outcomes.
And those outcomes were?
Lower drug prices, at least for the Medicaid segment, which is a
Yeah.
visible political win. And second, that huge $70 billion domestic investment figure, which plays into jobs and manufacturing narratives. The cleverness, or maybe just the complexity, is linking them, using trade tools to achieve healthcare and economic goals all at once. It's a very ambitious, high-stakes approach.
High stakes indeed. That balance feels critical. You've got the immediate savings for patients, those hundreds of millions a year, which are relatively concrete, but that's weighed against this enormous $70 billion investment pledge, which happens over years and depends on Pfizer following through. Feels like a big bet, right? Betting that the long-term economic promise justifies the immediate concessions and complexity. Well, this has been incredibly helpful. A really deep dive into a fascinating and complicated agreement based on the sources you provided. We've touched on MFN pricing, the role of tariffs, that huge investment, and this new Trump RX platform. Thanks for walking us through the details of that Trump-Pfizer pact.
My pleasure. It's certainly a deal that introduces some potentially very disruptive elements into the whole pharma landscape. We'll be watching how it unfolds. And that actually brings up a final thought, something for you, the listener, to maybe chew on after this. Considering this new Trump ARC platform is built specifically for discounted direct purchases from manufacturers, how might having a permanent government endorsed channel like that fundamentally change the game for the traditional middlemen? Thinking especially about the pharmacy benefit managers, the PBMs, how does it shift their negotiating power, their whole business model in the U.S. drug market long term? Something to consider.